Thank you. Let me shift gears just a little bit here now. I'd like to ask a question concerning health care. I think there's been a lot of conversation, at least at the national level, which both of you are advocating for a national seat, since you're going to be part of that debate. And it seems to me that everybody in this room probably recognizes there's a lot of folks here in Alaska and across our entire country who are not covered by adequate or even any health care insurance. And many of us are also fearful of losing our jobs for what minimal amount of health care we are provided through that. And then, of course, once you do find a new job, there's this thing called pre-existing conditions. So the people who really need the medical assistance are going to be shut out anyway. Making it into the U.S. Congress, what positions would you take? How would you try to resolve this problem so that we have a situation where we're actually promoting the health of people rather than the wealth of a couple of health care insurance companies? You're first.
Everybody who needs health care should be able to get it. And everybody who provides health care should get paid for it. And when I travel around Alaska and I talk to the people who work at the neighborhood health clinics, when I talk to the patients, when I talk to the providers, there's a huge problem in this state. There's 120,000 Alaskans who don't have health care. Veterans get shipped to Seattle in order to receive health care that they can receive locally. That's not right. You know, we all want the day when every American receives health care, when the 50 million Americans who don't have insurance get it. And I'm looking forward to that great compromise that's worked. But in the meanwhile, we have to work for the 120,000 Alaskans, including 20,000 children. We need to expand Denali Kid Care, which is a federal program. We need to make sure that wellness and prevention programs exist so we reduce the cost and consequence of things like drug and alcohol abuse. 80% of people who are incarcerated are drug and alcohol related. The costs of drug and alcohol through our society are huge, and tobacco. We need more prevention and cessation programs. We need to make sure that small businesses can buy insurance over state lines and can pool together. Because we have to do things for ourselves instead of waiting for the federal government to come up with solutions. The consequences are too dire. We need to be in control of our own destinies. And Alaska has the resources to do it. We're looking at a state government that's talking about a $9 billion surplus over the next year. And all the answers are not going to come from the federal government. But the federal government's responsibility in all this is to make sure that Alaskans have the opportunity to solve the problems. Healthcare is a frightening thing. Anyone who's visited, you know, when I think of watching people I know who've been in hospital beds and saying goodbye to them and worrying how you're going to pay for it, we should never be in that position in this state or in this country. When I talk to my friends who are working for nonprofits and have to make the choice of eyeglasses for one kid or dental care for another, that shouldn't happen in this country. We're better than that. We're richer than that. And we need to live up to who we're supposed to be. So the question of health care is twofold. What is President Obama or President McCain going to do? And what kind of great initiative are they going to deliver that's going to yield care for all Alaskans? And at the same time, what is Alaska going to do for itself? Because we have the ability to solve a good chunk of the problem if we take our own initiative. And that's what we should always try to do. Don't just wait for Uncle Sam.